My name is Marijeimi Monterrosa, and I am Geisinger's first on-site Spanish interpreter. Language line devices are available in different forms throughout all the hospital facilities for inpatient and outpatient. We have language line on wheels, so it's an iPad where you can contact an interpreter. We have more than 230 languages available. And we also have the iPhones that we have throughout the units, in which you can find the Language Line app. These services are important because you want to make sure that your patient is safe, and safety begins with proper communication.
It's very crucial to have some sort of interpretation, just because, I know very, very, very pequeño Spanish. I don't even know if I said that right, but I know very little Spanish. So if we weren't to have a language line, it's almost as if we wouldn't be able to perform our test for the patient. They wouldn't be able to explain things to us that we would need to know, as much as we wouldn't be able to explain to them how the test is performed, why they're getting it.
With these services that we have now via the iPad as well as in person, we're able to explain things more in detail. We're able to get more history and show them compassion that we might not necessarily be able to provide with nonverbal cues.
Communication with patients that don't speak my primary language has been a challenge throughout my career. However, interpretive services makes a huge difference, and it helps to breach barriers that were very troublesome before are not anymore. I had a young patient, he was I think 18 or 19 years old. I had gone in, I spoke with him. He said that he spoke English very well. We communicated very, very well, or so I felt. I got a good discharge plan with him and everything. And then later, throughout his inpatient stay, the in-person interpretive services became available, and I was able to go in with a live person and have almost the identical conversation that I had had with him previously, except it went very, very differently. And I was able to actually help provide some services and some equipment that he was not willing to ask for, maybe because he didn't have the right words to use or whatever the breakdown was. His follow-up care really was substantially better because of that.
When patients are able to see someone that speaks their own language, they get very excited and very relieved. They feel more comfortable. You can see it on their faces. Their face just brightens up, and they are willing to ask more questions.
There have been multiple instances where MJR Spanish interpreter has been essential in terms of having the family and the patient understand what is going on.
I remember I had a patient who was a drowning, and he was under a creek, frozen under a creek. And it was probably the first week that we had our interpretive services. Having the ability to speak to this family about a terrible situation and telling them that their child had passed away, it's a terrible scenario altogether, but being able to talk to them in their own native language or communicating with them in their language, I'm sure it meant so much to them.
I want everyone to remember that safety begins with communication, and I really want everyone to put themselves in the patient's shoes. They came from different countries, they speak a different language, and if that was you, you would want to feel welcome and well treated, and you would want to communicate in a language that makes you feel familiar and comfortable.